Good morning, viewers. Welcome back again to IPC with Nikki. Happy Thanksgiving. I hope we enjoy a lovely weekend and Thanksgiving period. Today, we're going to discuss another important function or role of infection prevention and control practitioners, especially during festivities or festive periods. I have observed that a lot of outbreaks, especially during this respiratory season, during the cold periods, that a lot of outbreaks and infections spread faster and quicker in our facilities, hospitals, long-term care homes, group homes after festive periods. And you wonder why, right? As I tell people, infection control is not rocket science. It's very simple. It's because during these periods, these are the periods that a lot of people come together more. And if there is increase in community spread of diseases, it will definitely reflect in our facilities as well. Everybody wants to come together as family, like Thanksgiving, for example. People want to visit their loved ones whom they've not been able to visit. They want to share Thanksgiving period with them, meals, activities, culture, and whatever, and so much more. So it is not surprising to see that after festivities or during festivities, we experience increase or surge in the spread of infectious diseases. So you might wonder, what can you do as an infection preventionist? Does it mean that an infection preventionist is not entitled to a lovely Thanksgiving with your families as well? No. But there are steps you can take that can help reduce the spread of infections during this period, and that's what I'm about to talk to you about today. Okay? Remember, this is a learning platform. This is also a social media platform. You're free to add your discussions. I know some experienced infection preventionists are in this, are watching this. So you can share your comments, you can share your advice, you can also share your contributions or experiences that can help other healthcare professionals during these trying times or during this period. Thank you, everyone. So, as I said earlier on, I'll be sharing with us some tips that can help us in our role so that after the we can enjoy our break and also the festivities and the activities. And after the activities, we don't necessarily have to struggle with dealing with a lot of outbreaks and a lot of sick residents and patients. Okay, so one important tip I would like to share with us is knowing our team members that will be working in our absence. If you'll be absent during the festive period, there's no one shoe fits all. In some organizations, of course, the infection prevention is not available during holidays and during weekends, while in some other facilities or organizations, you have infection preventionists for every shift or every time period in time. So whichever one yours is, that's okay. We still all have a role to play. So if you know you won't be available on site during this festive period, try to know who your team members are. I'm talking about the frontline staff. If you're in the hospital, the nurses, the people who will be performing direct care and be having direct contact with um, residents, patients, individuals in the group homes. And you're wondering why this is important. This is important for you to provide a kind of review. They might even be experienced professionals, but just to remind them, just to provide a kind of review and go through the process with them on what they can do in case some things come up in your absence. I'll be shedding more light on this. Another thing is to have an open communication line. Okay. Again, that does not mean we cannot enjoy our break, but based on our role, sometimes a lot of things can be prevented if our staff or other individuals can reach out to us if they're having confusions or they need clarifications when incidents occur during these festive periods. So the point I made earlier on about knowing your team is very important because when you know your team, I'll give an example with a long-term care setting. Okay, when you know the registered staff who is going to be in charge of the home, you can give them education or re-education on some things they can expect and what they can do. For example, you let them know you can provide a very simple step to step actions they can take if a resident comes up with cough, sneezing, and some symptoms. Okay, what they need to do immediately just to ensure that the infections cannot spread. Okay, so those are some of the examples. Also, how they can provide education to families that come in to see their loved ones, especially if the loved ones are on additional precautions or on isolation for a symptom. Okay, so these are some of the things that can help the spread. Why this is important is because during this period, if these measures are not put into place, there's possibility that a lot of residents, a lot of patients, a lot of individuals in these groups or in these settings will become infected. And remember that infection prevention and control involves reducing as much as possible the spread of diseases. Yes, from time to time we will have one persons or two persons coming up with one thing or the other, but we can actually prevent it from spreading to a larger group of people. And that is one important area of our practice. Okay, and I mentioned again that communication is very important. When people are able to communicate with you in case they have clarification, sometimes you have new staffs who are new to their job and some things just spring on them. Also, sometimes when staffs are carrying out their own other duties, they might not necessarily be able to think back on what the policy says about something things. So you might be doing well for yourself and for every other team member by preparing ahead, preparing the team ahead, telling them what to look out for, telling them what they can do based on your organization policy. We cannot control everything, okay? But you just do your best with available resources and share with other team members to ensure that infections do not continue to spread in our facilities and the community at large. I'll see you again next week after the festivities. Join us again next time. As I said earlier on, for our experienced infection preventionists, please share in the comment section things that you've been able to do to prevent spread of infections during the festive period. Till we see next time. Bye.